everybody to our show today. We have Jennifer Harrod with us again today, and again, I'm Sarah McLean. We're glad that you guys are joining us. Today we're going to talk about just different terminology in the cancer world. I know that when we get thrown into this, there's so many things, words being thrown out there that we have no idea what they mean. We don't understand implications of certain things, and so we thought that it would be a good idea to kind of go through. Let's talk about the different types of breast cancer, the different stages, different hormone receptors. What does all that mean? And so thankfully, because Jen's a nurse navigator, she can bring her medical expertise to us today. But let's start off first with just the types of breast cancer. Okay. So let's run through that first.
Okay. So there's Dcis, ductal carcinoma, in situ. That just simply means that the cancer is within that duct. It has not escaped outside of that duct, so it's confined. So a lot of times you'll hear that as stage 0,
Okay.
which is actually what I was.
Mm-hmm.
So that's one that a lot of times I wish doctors wouldn't say, and they'll say, oh, well, you have the good cancer. Well, there's no good cancer.
I hate it when they say that. I know. All of us, regardless of what stage and what kind, you hear that word, you've got the diagnosis, and it's scary. And
Yes.
so we want to just make sure that everybody understands that just because you have the good kind doesn't mean it's not scary. And we want you guys to know that it's all significant. And I know Jane had said before that we all have a different story, but they're all unique too. So
Definitely.
So what else do we have?
So after DCIS, if those cancer cells escape outside the duct, then they are called what's, you'll hear invasive. So it's an invasive cancer.
So that's IDC, invasive ductal carcinoma.
Right. So
Okay.
you'll hear that. If those cells escape outside of that duct, they have a tendency, of course, to spread to other areas, maybe your lymph nodes or to other areas of the body. So that's when you start hearing stage 1, stage 2, just depending on where it is spread and if it's localized just within the breast.
So invasive does not mean metastatic.
No, not
Those
at
are
all.
two totally different things.
And I think that's what's scary a lot of times when people do see their pathology reports, because they'll see, oh, well, it's metastatic in your lymph nodes. Okay, well, it's spread there, but that does not mean you're stage 4 metastatic. And to me, that's scary. Oh gosh, I'm metastatic because it spread to my lymph nodes. No, because it could be contained to just one lymph node or 2 lymph nodes. You don't know. So, a lot of times you're going to have that first staging whenever you get all of your lab results back, all of your imaging. The doctor's going to say, okay, this is what stage I think you're at. But really, until they go in there and they do the surgery, they're going to come back and stage you again sometimes because they don't know what they're going to find.
Right.
Imaging can only see so much,
Mm-hmm.
and our hands, the surgeon hands, I mean, they can feel a lot and know what they're feeling, but they don't know 100% till they get in there. So once they get that pathology back, then they'll go over it with you and tell you a little bit more about what they see, whether we thought it was DCIS, but now we see it's invasive. So you really don't always know.
Okay. So then we also have, I know I had mucinous carcinoma.
Mm-hmm.
So that, I know it's a slow growing one.
Right. And there are, oh goodness, so many different ones, honestly, and we're not going to get into all of those, obviously.
There's like lobular, mucinous,
lobular.
which we have a lot of different people who've had that too.
Exactly.
Yeah.
So, lobular sometimes can be slower growing. I mean, there's just different ones out there. So your most common, obviously, are going to be your ductal
Mm-hmm.
and your invasive.
And then that's why it's important for you guys to know, because some of them are slow growing, some of them are faster growing, like triple negative.
So triple negative, yes, it can be more aggressive, but then HER2 can as well. So those are both aggressive. Also look at your grading. Are you grade 1, grade 2, grade 3? Because that's going to determine how fast those cells are dividing and what they look like under the microscope. I was grade 3, So if you're going grade 1, grade 2, grade 3, I win the lucky prize of being grade 3. So that means that there was more necrosis of those cells. They don't look as normal as, so if you look at grade 1, those may grow slow for years and may not cause you any trouble.
Okay.
But if you look at grade 3, those puppies are dividing. Those cells
You
are
need to
just...
do something quick.
Exactly. They're more aggressive.
So if you're stage 3, grade 3.
Yeah, grade is what you're really looking at, and that's going to determine you may need to be a little bit more aggressive. Quicker. I went ahead and did double mastectomy for DCIS because I was grade 3.
Yeah, it's growing fast.
Yeah.
Okay, let's come back to triple negative. What does that mean, triple negative?
Okay, so that means you are ER, estrogen receptor negative, and PR, progesterone receptor negative, as well as HER2 negative. So, you know, a lot of times I was estrogen and progesterone negative. So I thought, oh, yes, I won the jackpot. I don't have to take any of the hormone blockers afterwards. I don't have to deal with those side effects. Well, yeah, that's all nice and dandy, but also the hormone blockers are going to help you to suppress the estrogen, progesterone, so that you're not worrying about as much the cancer coming back. It can help fight it. With hormone negative and HER2 negative, then you don't have anything really, a lot of choices about what you're going to, a lot of guns in your arsenal. They're coming up with more, and that's the great thing about technology. There are more and more things that can be offered for triple negative. Thank God.
So now the HER2 is not a hormone, that's a protein.
Yes, that's actually a protein. And back in the old days, not too long ago, there was nothing that they could do for the HER2. So nothing that could target that. So medical technology's come a long way, and the advances, now they have specific medications, chemotherapies that they can give to target the HER2 protein. So with HER2, if you think about, if it's really aggressive, and really growing quickly, that can almost be a good thing too, because if we have something to fight it, if something's growing, something quick, then we can target them, and a lot of times it'll kill them and have a better chance of killing them because they're so aggressive. So that's actually kind of can be a good thing nowadays, that we have something there to fight them.
And thankfully, like you said, research is always continuing. That's why a lot of things we talk about over and over again, because things are always evolving, always advancing, and there's different medications that are coming on board, different modalities that you can use. But again, that's why you guys, we want you to be educated and know specifically about your diagnosis, because it helps you to make better choices and just have an awareness of what's available to you. So everybody has a different protocol too. Just because you might have the same type doesn't necessarily mean you're going to have the same exact process, because that was kind of confusing for me. I know whenever I came into this world, you kind of naturally will assume, oh, you're going to do this, that, or the other. Well, no, not necessarily. Thankfully too, they've learned that they can test biology of tumors to know specifically what's going to work for your body, your age, your history, all those things. So with that being said, explain to me the difference between adjuvant and neoadjuvant chemotherapy.
Sure. So neoadjuvant is going to be if you need a chemotherapy prior to having your surgery, essentially. Some, especially if you're HER2 positive, a lot of times they will give you the neoadjuvant chemotherapy prior to doing your surgery, because a lot of times they can shrink that tumor down, so they may be able to just do a lumpectomy. And also you can see how is that chemotherapy working, because you may come in after a couple treatments of chemo and oh my goodness, I can't even feel it.
Right.
So that's wonderful. It's working.
That's awesome. Yeah.
So that's really a wonderful thing, having that neoadjuvant. There's also the adjuvant, meaning after you've had your surgery, they'll go in and do chemotherapy. So either way, you have two different options, but it depends on your specific cancer. So there's no, like you said, there's no one certain treatment or one certain way.
But that's not available to everybody though.
Correct.
You have to be a certain stage and grade to even be a
Correct.
candidate for that.
Correct.
Okay.
And that's why
So you can't just go ask the doctor, hey, I want to do this, just
No.
to shrink it. Yeah.
No, because it may not be effective on your tumor.
Yeah.
So your oncologist is going to be the best one to guide you
Mhm.
as to what's coming next. Kind of like a game plan
Mhm.
as to, okay, we're going to do this, we're going to do this.
Mhm.
And they're the best ones to guide you with what's going to be best for your tumor and what's going to target that.
Mhm. Okay, now talk about the Oncotype.
Right. So the Oncotype, so not everyone has that done. A lot of times they will if they go in there and think, well, we're not really sure. We're not sure if you're going to need chemotherapy. Let's go in here and do another test
Mhm.
and send it off to the lab, and we're going to get it back. Sometimes it takes about a month, just depending on.
Mhm.
But then they're going to look and see, okay, if you are over a certain number, then yes, chemotherapy is going to be beneficial to you.
Mhm.
And some women, they'll get it back and they'll go, oh, well, you don't need chemotherapy. It's not going to be beneficial to you.
When you say not beneficial, what do you mean by that? Like, why would it not be beneficial then?
They may look at the number and the score, and when they give you that, they'll give you a printout of how effective, percentage-wise, how beneficial would it be
Mhm.
to help you out with the cancer not returning.
Mhm. I know that's
So-
what happened to me on my second diagnosis because it was a different kind of cancer, but my oncologist was like, let's go ahead and they test the biology of the tumor. It's sent to a lab in California,
Yes.
and then they come back and because sometimes it can be more harmful than helpful.
Right.
And so that was how he explained it to me. Unfortunately, mine was in the middle, and so it was like I got to choose what I wanted to do. I chose not to just because I don't do well with drugs. I've had some problems in the past with that,
Yeah.
but that's another option for some folks. Okay, let's talk about BRCA, genetic mutations.
Right.
So explain what does that mean?
Okay, so a lot of times if you go into the doctor's office, the oncologist, and it may be your age, it may be the amount of family members, close family members that have had a certain cancer in your family, they may say, we need to go ahead and do genetic testing for you.
Mm-hmm.
They can do it different ways. They can do spit, they can do a swab, they can do blood, so many different options and so many different ones out there, and the price has come down considerably.
Thankfully.
Yes, yes. And there's so many new genetic mutations that they're finding nowadays that when I had mine done back in 2018, there's so many new ones
I know.
now that I'm like, should I have it
Do it
redone?
again. Yeah, yeah.
But a lot of times there may not be a genetic mutation in your family. It's just a lucky, we just have a luck of the draw that we got cancer.
Mhm.
But if there is, then they're able to find that and send you to a counselor if you're BRCA1, BRCA2 positive, and there's other mutations out there that may make you more susceptible to
Different cancers.
exactly to other cancers, whether it be, lung or, GI. I mean, there's so many different cancers out there. So if they find that, it's scary, and yes, you do want to plan ahead and see a counselor of what you can do to help prevent those cancers from coming. And they'll also set you up with additional screening, and they'll closely monitor you. So if anything does arise, they can get it out of you quick.
Mm-hmm. Okay, so we've covered the different types. We've covered a couple of different types of terminology and testings. Let's go back to you've talked briefly about grades. Let's talk a little bit about stages.
Okay. So stage 0, of course, is going to be your DCIS. So it's going to be where it hasn't escaped the milk duct.
It's just right here in the duct.
Yeah, just right there. So a lot of times they can just go in and remove it. Sometimes, depending on if you go for a lumpectomy, you're going to be checking the box to go ahead and have radiation afterwards a lot of times.
And that's just preventative, just to make sure we've
Yeah.
killed all those microscopic cells.
Just go in there and sterilize those cells. If you do a mastectomy once you're later on, which is what I decided to do, I did not have to do radiation, but that's no guarantee. So once they get in there and do the surgery, you may still have to do radiation, and that's going to be completely up to your oncologist and what they see as fit for your diagnosis. But then you go to stage 1. It's escaped out of that milk duct, and there may or may not be a lymph node that's involved. So that's going to depend on, do we need to do chemotherapy? Do we need to do radiation if you do a lumpectomy? So there's different choices you have there along the way as well.
Mm-hmm.
I also always like to refer back to my handy dandy little sheet, and it gives you a stage 0, stage 1, stage 2, because there's different sizes as well, depending on the size of the tumor.
Mm-hmm.
So stage 1 is actually considered the tumor's 2 centimeters or less in diameter.
Okay, so that's the difference in the actual
Right.
stage is the size.
In stage 1, it's not spread to those lymph nodes.
Mm-hmm.
However, when you get to stage 2, there's stage 2A, 2B. So there's,
It gets complicated.
yeah. So that's why definitely they're going to give you pathology reports,
Mm-hmm.
and on there they're going to stage you.
Mm-hmm.
And that's what you want to look at, because that's going to give you your true staging. If you try to look at this, sometimes it's confusing.
Yeah.
Because if you look stage 2, the tumor can range from 2 centimeters to less than 5 centimeters in diameter. And sometimes lymph nodes may not be involved, but sometimes they are.
So when you get to stage 3, is that when you start having lymph node involvement?
So if you look at stage 3, there's stage 3A, B, and C. So it just keeps on spreading out and getting really confusing. So stage 3A, the tumor's 5 centimeters or greater in diameter. So, and the tumor may be any size where the cancer cells have grown extensively into the axilla lymph nodes. That's going to be your underarm area.
Mm-hmm.
So it can be either the size or it can be the spread extensively into the underarm.
Okay.
Okay. Stage 3B and 3C. So that's known as your locally advanced. Tumor may be of any size, but has spread into the skin of the breast,
Oh.
or tissue of the chest wall, or the lymph nodes near the collarbone.
Oh.
So right in here. So that could be your 3B, 3C.
Okay.
Then we talk
4.
about stage 4.
Yeah.
And that's considered your metastatic. So it's spread to other areas outside of the breast. So that other area could possibly be your lungs, your liver, your brain, bones. So that's when it's considered metastatic. Correct. And metastatic's a different area that I know we aren't going to get into today.
Yeah, maybe we'll have one of our leaders in the metastatic group come on, and we can have some more
That'd be
conversations
great.
about that. Yeah.
Because that's just a whole bunch of different, there's definitely so many treatments out there
Mm-hmm.
that will help you to really thrive in your life.
Yeah.
Give you some longevity.
Well, thank you. That was awesome. We think that it's important to have education and knowledge because it helps you to be empowered to make good decisions. So if you guys are enjoying this channel, make sure you do the thumbs up, subscribe, and thanks for being on here again with us.
Thank you.
And we'll see you guys next time.